back to Mental Health, where we take pop culture, social issues, and politics and look at them from a mental health lens. Today I wanted to talk about a movie that greatly... First of all, I just love this movie. It's a really fantastic, well-made film. Really enjoyable to this day. It's aged really well. Kind of sad watching it nowadays for extra reasons on top of everything else. But this is also the movie that I kind of attribute to me developing an interest in going into the counseling profession. And I still talk about that to this day when I introduce myself and talk about my background. I think Robin Williams' portrayal in this film is just so loving and caring and so full of empathy, and he does a great job. So not to bury the lead here, but I'm talking about Good Will Hunting with Matt Damon and Robin Williams. And I wanted to focus on it because I think it's a really great, sort of as I was alluding to already, a great portrayal of good counseling. There are some issues I have with it, and obviously it's a large-scale Hollywood movie, so they're going to amplify certain things. But for the most part, Robin Williams is a great counselor in this film. He does a lot of things right. I'm going to talk about a few qualms I have towards the end with some of his approach. But for the most part, really great and something that's worth learning from. I've even seen people use clips from this as examples of what to do and what not to do. But before I got into that, I wanted to sort of talk about Will as a character, because similar to the other episode that I did on The Haunting of Hill House, Will's a great kind of example of what childhood trauma looks like in an adult, or a young adult in this case. He has so many textbook examples of just what that looks like, and again, a very realistic portrayal of it too. Somebody might look at this and have some questions in their head of, well, does this really make sense? Like, especially... I think I've seen some people take issue with the fact that, like, well, if he's so, like, super intelligent and great at math, and he's, like, this whiz kid, but then he has all these behavior problems, like, I don't know about that. I've met many of these types of kids in my time. Every person who's been through trauma is a little bit different, but I've worked with multiple youth who are very bright, very intelligent in a number of different realms, and in some cases, almost like Will here, like super intelligent in certain areas. But then we're also, breaking all the windows in the house and getting into fights at school, engaging in problematic sexual behaviors and things of that nature. So those are all things that are kind of handled by different parts of your brain and your body, and it's all wired a little bit differently. So it's not that you're like all bad or you're all good. Like you've got capabilities in some areas and weaknesses in others, and that's very much the same of just any person when it comes to trauma. You can really excel in certain areas. I'd say even sometimes because of being through trauma. But there's always a downside. You're always paying for it in some other area. But yeah, in any case, the detrimental areas for Will is he's very manipulative, has a very inflated but ultimately hollow kind of sense of his abilities when we first meet him and see him having conversations with people, especially other professionals. He comes off as very smug. He's very kind of seems high on himself, but it's all kind of a front, and we discover that more so as the movie progresses. But I'd say this was the case for 80% or so of the kids that I worked with, that initially they would put up this similar facade of, I think I'm great, I think I'm this tough person, and nothing can hurt me, and you can't, break me down. You can't understand me. Often acting in ways to kind of test me. There's a lot of testing going on in terms of, are you really going to stick around even when I'm at my worst? I don't think you will. No adult can handle me, so I'm going to say things and do things to try to scare you or make you uncomfortable and prove to myself ultimately that you're not going to stick around. Because that's sort of the cognition that's floating around in their head, is that nobody can handle me. This counselor can't handle me, therefore they can't understand me. There's no point in doing work. And your job at that point, really within the first week or two, is to just prove that wrong and show them that you will stick around even when everybody else is terrified. We see this particularly in Will in terms of just his relationships with other people. Very kind of shallow. He's not willing to dig in deep because that is uncomfortable for him. And that's very common. People who have been through traumas, their attachment and ability to have empathy for other people and truly connect with other people is severely damaged. And when they go to that place, it creates a lot of anxiety. And that anxiety is paired with this sense of feeling out of control. And people who have been through trauma, often that's like their number one need, is to feel in control of situations. So things like that manipulation and lying and all that stuff starts to form as a product of that. And we see that with Will, where he's even kind of a pathological liar on some level. There's that great scene where his new girlfriend is asking him about his family, and obviously that's a very personal thing. There's this thing called the intimacy barrier when it comes to working with people who have historically had really rough childhoods. And the basic idea is, you can see it on like this graph, but the basic idea is that there's a whole range of human communications that people have varying comfort levels with, from very casual conversation to more intimate conversation. And depending on what your history with your caregivers looked like, that will put a wall kind of between what you're comfortable with and what you're not comfortable with. And so for Will, this conversation has potential to kind of jump over his intimacy barrier into much more personal and intimate territory. So to cope with that, to manage that so that he doesn't have to go into that lack of control and vulnerable space, he just lies about it. And that's, again, been my experience with working with a lot of young people, is parents commonly complaining to me that my kid's a liar, they lie all the time, and they're kind of misunderstanding where that's coming from and seeing it just as this malicious thing to kind of get one over on it. But it's really just another coping strategy. And again, we see that here with Will. So instead of going into that vulnerable space, he makes up this story about this like 7 siblings or whatever that he has. And he's gotten so good at it that she even challenges him in that great moment where she's like, what were their names again? Because he has to rattle off those like 7 names, and he rattles them off again almost perfectly. He may get one of them wrong. I haven't really examined that closely. I've always wondered about that. But in the most case, he gets largely them right enough for her to believe him. And so it's very kind of almost rehearsed. And maybe it is rehearsed. But again, all in the name of kind of self-preservation and feeling safe and in control. And it's sad to me because these people often get labeled as things like borderline personality disorder, which is just seen as this very kind of very explosive, manipulative person. And that diagnosis is often stereotyped as being very difficult to work with, which isn't untrue, but also just seen very negatively. People tend to attribute kind of poor motives to it. And no doubt that, I've worked with some of these people and they are very challenging, but it's all coming generally from this place of self-preservation. This is just a strategy that they've developed to both internally and externally feel more safe and in control of their world and their situation. And so for this work to, deal with these types of people on a daily basis and do really good work and make progress with them, you have to be willing to roll with the punches. This is not a field for the lighthearted. You're going to hear a lot of provocative things, and again, they're going to challenge you because they're testing to see if you can really handle it. And I've seen a lot of young specialists kind of fold in that situation. And going back to the movie again, there's this great montage of him going to see counselors before he ultimately winds up with Robin Williams, and they he messes with them. And it's so true, because this is exactly what they do, from young children to young adults to fully grown adults, people who have been through these backgrounds. Again, like, they will test the waters. He challenges that one counselor and starts calling him out, and says that, maybe you're gay and I don't have a problem with that, but he's just kind of poking at him. He's zeroed in on some sort of insecurity and is now exploiting that to, again, prove in his own mind that these people can't handle me and they're not going to stick around when things get tough. And he gets to affirm that hypothesis. He does that with the first counselor, and he gets very offended and how dare you kind of thing. And again, I've seen counselors who do that too. I've said it before. All counselors, just like in any job, all counselors are not created equal. Some people are better suited for their jobs. Some people have stuck it out more. Some people have gotten a lot more training to be able to deal with these things, whereas other people come in and they're like a deer in headlights, and they just respond with their own kind of issues and get indignant about it. I've seen it happen where I hear the stories of kids past counselors just not being able to handle what they're dishing out. And it's unfortunate because that just further entrenches every single time these kids' own cognitive distortions that are going on through their heads. And then with the second guy, he just kind of makes a joke out of the whole hypnotherapy process, and makes up this story, acts like he's getting really serious with this past sexual abuse, but then he just starts breaking out into song. And again, the counselor gets very mad because he's kind of challenged his sense of professionality, and it's clear that this counselor is like, well, this person doesn't want to work with me, so it's not worth the time, which is completely the opposite perspective you want to have working with these people. Again, you need to be willing to, just as Robin Williams does, be ready for it, be expecting it, really. Just be ready for kind of anything. Know that they're going to, poke at you and test you at first and kind of see what makes you tick. And I'll say a little bit more on that later on. But again, all this to say that this movie does a really good job. It doesn't give you this kind of caricature of therapy being guy on the couch. It sort of almost pokes a little fun at that with the hypnotherapist. But for the most part, it's a much more realistic portrayal of what it actually looks like in action. And again, also has Will as this excellent version of what can trauma actually look like, where you've got this fully interesting person that you can empathize with and has, a really intelligent side and a really sweet side and wants to be loved and wants to care for others and wants to do well by his friends and other people around him and his future, but is just so damaged by his history that he really just doesn't know how to do that. He doesn't know how to deal with it, and can't handle it. He even, ultimately pushes his girlfriend away because he can't deal with it. And in his head, he's kind of justifying it in terms of somehow he's like protecting her. So when the truth starts to come out about his family, his lies start kind of falling apart, and there's that very emotional scene where they're screaming at each other, and he's saying, you want to know about like basically how my dad used to beat me and where these scars actually come from. And she's crying, and she wants to get into that part of the world and has no idea, and isn't just hasn't been ready to truly understand what's gone on with him. And in his mind, he's kind of protecting her. That's the way that often these people put it, is they'll come up with some sort of rationalization in their head of why them pushing the other person away is the right thing to do, out of either somehow protecting them or protecting themselves or whatever. And in this case, it seems very much like in his mind, he's convinced himself that, I'm going to end up hurting her. So therefore, like, I have to be terrible to her right now to get rid of her so that she doesn't have to deal with it. But ultimately, again, that's all just fake. What's really happening is he can't deal with that intimacy. With the facade breaking down, he's in that uncomfortable, personal, intimate space that he's not used to. And he's never had any models for it, too. This is just the case with trauma. I mean, you learn that even the people that you're supposed to trust and depend on the most, who are supposed to be looking out for you and taking care of you, can't be trusted either. So you never really learn to depend on other people and learn what it is to be in a comfortable, deep relationship with someone where that's a safe thing. So even though his relationship with this young woman is fantastic and she's so nice and everything's going so well, that is exactly what's increasing the discomfort, because he doesn't, it's kind of like, better the devil you know than the God that you don't. So, he only knows kind of chaos and pain and strife. And so to be suddenly in this what should be a comfortable space is very uncomfortable for him, because he's just never known that. And we fear the things that we don't know and that we don't understand. And we'll often reject that in favor of what we do know, even though this other thing might be better. But it's a gamble. It's like, I don't know for sure about this thing. I know this other thing is awful. I know that my life right now is kind of miserable and not great, but at least I know what that is, and I know what to expect from that day to day. I don't know what to expect from this other thing. So moving on to Robin Williams more specifically as a counselor, I said this movie inspired me to become a counselor, but I see particular things that he does that I think kind of just stuck in my head as I started to practice, because I've seen myself doing some of them with a lot of success. Like the most obvious one that always stands out to me, and I give this example all the time in training, is we as people are just very quick to fill silences. We all tend to feel pretty uncomfortable with them on average. If there's a big lingering, we all say that it's kind of awkward to just sit there and deal with it. There's even that great scene in Pulp Fiction too, where Uma Thurman talks about how, wouldn't it be great if we could just be willing to just sit down and shut up and deal with that silence, because it's a good thing. And I agree with that. So Robin Williams utilizes that in this movie in the whole he has to talk first thing. And that is often very true, because specialists' rookie mistake is to talk too much. And you start to tell people how they should think and how they should feel. And that's a great way to get your person to shut off. Like, they will turn off their brain, and now you're trying to do the work for them, but ultimately it's working backwards, because they're not challenging themselves. They're not thinking about the ideas. They may not even be listening to you. They just you turn into Charlie Brown's parents, and it's just, the wah, 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 wah. That's all they're hearing at that point. So better to know when to just shut up and be quiet and let things sink in and allow them time to really think through things and them start the conversation, because you want to know where they're at first before you kind of make assumptions and try to fix something where you may be headed down the completely wrong path. So he has that first set of sessions where Will doesn't even really speak at all and just tries to freeze him out. And I relate to this so much, because I will never forget this one kiddo that I worked with where they had a lot of reasons to not feel safe talking to me. There was the usual, I'm a stranger, I'm new to therapy, in this environment, it was a residential treatment. I don't like that I'm locked in here. I don't feel like I should be here. And then on top of that, there were a lot of cultural differences. There was some gang involvement. So again, just a lot of reasons to be like, I'm not going to talk to this person because they're not going to get me. They can't handle me. They can't deal with what I'm dealing with. They don't know what I've been through. And I got that. And so I tried my usual, like going into assessments and introducing myself and everything. And this kiddo was, I've had a number of kids who were very quiet at first and were hesitant to start talking, but usually within the first couple minutes of the session, I can find some way to get them to open up. This kiddo, though, dug their heels in and was not having it. And I recognized that, and I just said something along the lines of, hey, you know what? I get it. I'm a total stranger. I just rattled off basically all the things I just said. Like, there's a lot of reasons for you to feel like I can't get you, and on some level, you're right. Like, I can never fully understand where you've come from, because I've probably come from a very different place. We're two very different people from very different backgrounds and have seen very different things. And that's fair. That's totally fair. There's really no reason in the world why you should talk to me. But I'll tell you what, we have an hour together. I'm going to meet with you every week. I'm going to give you that full hour. And whenever you feel ready to talk, go ahead. And I sat with this kiddo for about 4 weeks in silence. And this is another rookie specialist mistake I see all the time, is when that silence sinks in and they get to like the 15-minute mark or so, they in their head are kind of like, okay, we're wasting each other's time, and they will end the session. And they'll still say like, hey, whenever you're ready to talk, I'm here. But ultimately, you're still reinforcing that negative cognition that they've got, which is, this person can't handle with me. They're not going to stick around. They can't deal with me. And by ending the session, you're kind of doing that. And I saw that very much with this kiddo. And that's what Will is trying to do in the movie too, is he's already had his fun kind of poking in on insecurities with these other counselors. And now it's like, well, okay, I'm going to use a different tactic this time for my own amusement, is to just not talk to them so that they get so uncomfortable that they end the session and they just give up. And I could tell that this kiddo that I worked with had similar situations where they had learned this strategy and had it reinforced that if I just don't talk, eventually they will give up and leave, and I won't have to deal with it anymore. So if success rate is 100% with the strategy, then why stop? If it ain't broke, don't fix it. So this kiddo tried it on me, but I sat there and I did the whole hour. I even had like a clock to be like, okay, this is your hour. When we're up, I'll take you back, but we're going to hang out here and whenever you're ready. And they were persistent. I had to give them credit by the end of it. I think I even joked with them about how persistent they were later on, and we were able to laugh about it. But for 4 weeks, they froze me out. But I knew I could not end the session early. I didn't even come in and do extra work. I think I had something to kind of fiddle with a little bit. But really, I just had it be a space where we both sat there. And I learned to get very comfortable with silence, because it's a very effective tool if you know how to use it in the same way that this movie uses it. And just like Will, who finally kind of gets sick of it and is just like, okay, are we going to talk about something? Ultimately, this kid did the same thing. And about halfway through that 4th session was just kind of like, okay, are we going to talk or what? And I jumped on that immediately and said, yes, all right, which one of these things do you want to go through? And from then on, they talked, and we developed a pretty good working relationship, and were able to do some good work. So I really can't say enough about recognizing that as an avoidance tactic. And avoidance is one of the symptoms of post-traumatic stress disorder too, just not wanting to deal with things and also develop relationships, because counseling is a form of developing a relationship. And it's just easier to develop coping skills like freezing people out to not have to go into that space. Another thing that once the talking does start, Robin Williams doesn't jump straight into a bunch of jargon and straight up strategies. I always like to have goals and keep things anchored in what specifically is it that we're working on. But you have to balance that with just a lot of very classic kind of Carl Rogers techniques, the foremost being just active listening. And so by active listening, I mean actually not only being quiet and listening to them, but actually hearing the words, processing the words, thinking about the meaning between the words. And instead of putting judgment on them, just reflecting them back through some restating, paraphrasing, summarizing. And we see that in the first scene where they're kind of going back and forth is Will is kind of being a little bit provocative. He's just kind of, again, testing the waters, talks about being laid and stuff just to see if it makes Robin Williams feel uncomfortable with dealing with that. And Robin Williams doesn't. Like, he just kind of rolls with it. He's like, oh, okay, interesting. So that's what's going on. Tell me more about that. Stating things back to him so that he is elaborating on what he's saying and developing some two things, really. One, he's making it a comfortable space to get a dialogue really going and get some depth going, and then also showing that I'm not swayed by you. Like, I can deal with all this weird stuff that you're saying. I had another youth that I worked with too that did this to the nth degree, and it made sense later on when I learned more about their history and all these traumas they had encountered in multiple spaces that really had not allowed them to feel comfortable anywhere and feel safe anywhere. And so this kid's tactic was to literally threaten you and talk about terrible things they would do to your family and how they're going to stab you or they're going to kill these other kids or whatever. Like, very super provocative, scary things that for the average person, they would probably run away the other direction dealing with it. And I had to bite my tongue again and recognize that this is just another defense tactic. It's extreme with him, but it's just another means of, I don't feel safe around anyone, so I will just keep everyone as far away as I possibly can so that I don't have to worry about them hurting me. I'm going to kind of go on a preemptive strike to make sure people stay way outside of my bubble so that I don't have to feel so afraid of them. And when I was able to take that approach and just roll with it, I would just kind of ignore all the really negative stuff they would say. And anytime they'd say something remotely neutral or positive, I'd really latch onto that and say, oh, that's really interesting. Tell me more about it. And I'd also come in with a really sunny disposition and be like, hey, great to see you today. I remember I came in one day and they had actually ripped down like light fixtures and torn if you know those, how metal doors have like that beam at the top that helps it close again properly. They had ripped those off of the tops of the doors, and so I came in to meet with them and they had a very self-satisfied look on their face, kind of like, how are you going to deal with this? Are you going to run away screaming from this one because nothing else has worked? And I just kind of looked around and I was just like, you've had a really busy night, and still smiled and didn't take I could tell that this youth was expecting me to go into the typical adult caregiver mode of, how could you do this? This is a terrible thing you've done. You should feel awful. And so they were very prepared to riff off of that and turn it into a conflict where, again, they could confirm in their own head that, yeah, see, like, this is what adults do. They don't get it. And they're just here to talk down to me and maybe even hurt me. And so I will then feel justified in my own negative behaviors to deal with that. And I didn't roll into it. And that was another youth too, where we ended up working for about 9 months together and did some really intensive trauma therapy and ultimately got them to a place where they felt comfortable not only sitting down and being real with me, but also sharing the details of their deepest, darkest traumas and work through them in this very trusting relationship. And we had to do a lot of work nudging up against that intimacy barrier to get there. And so speaking of doing that, so Robin Williams, again, in this movie, he balances that active listening with doing some really good work. There's this thing called the therapeutic window. And the basic idea is that everyone has this, it kind of is aligned with the intimacy barrier in that you have this comfort zone, and that's your therapeutic window. But what you're trying to do is expand their window and their comfort zone. You're trying to get them to a place of, okay, I can only deal with things that are inside this box, to expanding that box and being able to talk about other things. And you do that by kind of pushing them to that state of discomfort, right to the brink of what they're able to deal with, and then bringing them back. And Robin Williams, again, does a great job of illustrating this in the therapy scenes of this movie. So while they do a lot of like joking around and stories and engagement building work, he's also taking him to those more challenging areas. He connects back always to, this is what I'm seeing too, and I'm going to put this out here to make you feel kind of uncomfortable. So at first he's kind of just doing the active listening, repeating back, doing a lot of agreeing and validating, but he gets to that line of, oh, that's interesting. That way you can go through your entire life without ever having to really know anyone. And so he kind of is challenging his cognitive distortions there and saying like, hey, I'm kind of onto you. And I had a lot of moments with kids like that too, where I had to kind of be like, come on, man, don't bullshit with me. Like, we both know that this is actually what's going on. So you take them to that point of discomfort, and he lets that linger a little bit, and you see the discomfort on Will's face, where it's like, oh, I wasn't really expecting that. But you don't want to keep them there too long either. So then he immediately, right after that, rolls into the story about his wife waking herself up with her own farts at night, and they're able to kind of laugh. And so they go back into this more comfortable, casual space where they can feel safe and build that rapport. And then once again, he oscillates back to this very serious tone, kind of talking about his wife a little bit, and again, challenging Will on what's actually going on here and what am I seeing and how am I going to take what I know is kind of happening in your head and point it out to you in a way that makes you feel uncomfortable. There's this misperception that often goes around that therapy is supposed to be this kind of happy-go-lucky, positive space where you just air your grievances and you feel better. And I really challenge that, especially with the people that I train, that's really not the case. It's all about this therapeutic window. And part of the therapeutic window means that if they're getting too comfortable, it's time to turn up the fire a little bit and push them into a more uncomfortable space. So when I'm working with these kids and when I'm having specialists working with me, working with kids, I'm talking a lot about, okay, what dynamics are you seeing? Like how are you seeing this play out from a therapist perspective, and how can you kind of toss that out to them? Like throw out a little line about like, okay, this is something that can sort of step up the escalation here and make you feel a little bit bad about kind of what's going on, and then alternate between those two tones so that you're basically, it's like an inoculation. You're inoculating them with little doses of what makes them uncomfortable. Because if you go too far too soon and try to do too much and just examine all of the trauma all at once or all of a relationship all at once, then they might explode to the point that they won't want to work with you anymore. But if you're just giving little doses of here's this thing, here's this thing, here's this thing that you like have a hard time dealing with, and then you're retreating back to the comfort zone each time, their brain and their body is literally adapting to that. They're literally learning to adjust to it, because normally what's happening is that when that uncomfortable feeling raises up, it's literally lighting off alarm bells throughout their whole system saying, we're under attack. Our life is in danger. It's really activating those fight or flight zones that I've talked about in past podcast episodes. And so they're literally having the same reaction to like basically being attacked by a bear. And so by going there and then retreating back to the comfort zone where you're teaching their brain and body that they're not being attacked by a bear, that it's not a life-threatening situation, there's this moment of realization kind of subconsciously where the body's saying, oh, okay, we can actually handle that. That's not as bad as I thought it was. And so the line gets moved at that point, and they're able to deal with a little bit more. And so you step it up a little bit more again after that. And we see this progression in their relationship as the movie goes on, where he has that whole monologue too about his wife when they're out at the park, and really giving Will a hard time about, like, you haven't had any real life experiences. You think you're smart, you read a lot of books, but you really don't get it, and ties this back to his own deeper problems, like his inability to deal with relationships, and is breaking down this self-protective mechanism, even pointing it out to him and saying, like, this is what you're doing and you know what you're doing. But then he also goes back and regulates him a little bit more too, with some empathy, and validates him by saying, can I truly know what your life as an orphan was from reading Oliver Twist? And it's such a great line, because now he's flipping it around and saying, yeah, I'm giving you a lot of crap for feeling like you can know me from reading these books, or you can know about these big topics. But I'm also saying that nobody can know you from reading these books either, and that you're your own person, and you're valuable and interesting in your own right, even with all of your flaws. So let's talk about that. The other great thing too, again, is he says, your move, Chief, and then he just gets up and he leaves. And again, there's nothing more powerful than letting someone sit with the ideas. Because the problem is, if you stick around after giving that whole monologue and try to engage them right there and then, you run the risk of, again, these people who have been through trauma are such great debaters and arguers and manipulators, because their brain wants to go back to that comfort zone, and they do that by validating their own ideas. And so if you stick around, you run the risk of them arguing their way back into that self-protective state. And so Robin Williams doesn't allow that to happen. He just lays it on him, and he says, basically, when you're ready to talk again, I'm ready, and walks away. And Will has no choice at that point but to just kind of let it roll around in his own skull and come up with his own opinions about it. And again, I can think of past times where I had conversations like that, and I needed that moment of, hey, can I share with you something I'm seeing? And they said, yeah, sure. And I was like, it seems to me that, blah, 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 blah. This is the dynamic that's playing out. And often the first reaction from them would be, well, no, I don't think that's right. And I'm like, well, that's fine. Maybe I'm wrong. I'm not you. However, just think about it. Just let it roll around. See what you think about it. And I just left it at that. And we moved on to, I didn't get up and leave, but we moved on to a different topic. And I found that to be great, because sometimes, the next week we'd be taking a walk during session, and the kid would turn to me and be like, I was thinking about that thing that you said. And because I wasn't like forcing them and pushing it and trying to get into a back and forth, I let the power struggle be. I didn't get into it to begin with. And so they had that freedom to just truly think through it on their own, come to their own conclusions, and feel empowered by that, and learn a sense of control through being in that state of lack of control and discomfort and chaos, and realizing within themselves that they can handle that better than they think they can, and come up with their own meaning in a positive way, and not feel forced to do that. And that is where change truly happens, is when people are allowed to develop their own ideas, which is something that's not so great about a lot of talk therapy, is the specialist. And I'm guilty of this sometimes too, where I like to, I'm running a podcast, so clearly I like to talk. I don't have a co-host. I just jabber on. And so I can do that sometimes, and I have to catch myself and say, okay, you're talking too much. Time to shut up. Give them something to think about, and get them engaged in this and starting to talk about it. Well, Robin Williams even goes so far in the movie to, he kicks him out of session at one point. And I had never really thought about it until I was sort of preparing for this recording, and I was rewatching the scenes with all the sessions. And I'm like, what part of he's doing there is that Will at that point has gotten very comfortable with session. They've really broadened the therapeutic window. They're able to talk about a much broader range of issues, and it's more natural. And that's, again, the point to turn up the fire a little bit. Will's gotten a little bit too comfortable and complacent in those sessions, but he's still struggling with the same intimacy and relationship issues. And so what Robin Williams effectively does is he sort of shatters that sense of control again and that sense of safety, and just kind of says, you know what, sometimes life is going to throw some curveballs at you. Here's one right now. We're ending the session. That's it. And he's left to kind of deal with it. And that's definitely a more advanced method, that not necessarily the approach I would take, but I feel like that's kind of what's happening there in a more extreme way. Is just like, no, I'm not going to allow you to fall back into this complacency. I care enough about you and your progress that I'm really going to kind of throw some really tough stuff at you and still keep you in that constant state of having to learn to deal with increasingly more difficult things, including rejection, because that's what that's going to feel like. And so how do you cope with that and learn that you can handle that just as much as all these other things that we've talked about? Now, I also, there's some self-disclosure stuff that happens in here. I tend to be, as a rule, more leaning away from self-disclosure, because I think it runs the risk of you start to make the session too much about yourself, and that's never a good thing. But I do think there are examples of good self-disclosure, and you see them in this movie too. You know, they have a lot of conversations about his wife who died of cancer, and that's some pretty intense personal stuff. But it's done in such a way that it's all designed for Will and his own moving forward, and tying the story about his wife back to the lessons that Will is trying to learn, and learning how to have a model of true intimacy, because he's never had that. And so there's this kind of surrogate father kind of message going on, and you have to be very careful about it. I think it's navigated well. I do have, again, some issues in the movie where, you know, obviously there's an arc with Robin Williams where he's kind of learning just as much from Will about moving forward in his own life as he's trying to teach Will. And that's true in that happens in therapy. That's just a natural thing. I would never argue that I haven't learned anything from the kids and families I've worked with. I've learned a ton from them. The key, though, is checking yourself and making sure that that's not your goal. Don't fall in the trap. Am I pursuing my own needs right now? Or am I pursuing their needs, and then just naturally along the way, this knowledge is kind of coming to me? And you want to stay in that place of the latter. But for the most part, he does a good job. Like, he's constantly linking things back to, how can Will learn from this? How can this be turned in sort of a metaphor for something that he's dealing with? And I've had moments like that too. Sometimes it's almost unavoidable. I was on leave for a month at one point because of a personal tragedy, and my kids that I worked with knew very well that I almost never took any sort of extended vacation time. I was never gone for more than a couple days. And so they kind of needed an explanation when I came back. And I really, the key with self-disclosure too is really thinking out in advance. Like, what do I want to share? Why do I want to share it? How is this going to be beneficial to them? And ultimately, I decided that with my kids, like, part of what they were learning was dealing with how the world can be cruel and unfair sometimes, and how, you know, it's going to throw you some curveballs, and that you need to persevere. Like, you need to move on anyways. And also they were all kind of burgeoning young adults, and I wanted them to feel a sense of true, this is what it means to be an adult growing up in the world. So I told them what happened and the reason why I was gone, but then linked it back to that message of, you know, no matter how good of a person you are, no matter how hard you work, no matter how hard you prepare for things, sometimes awful things happen, and it's different for everyone. And you know this all too well, you know, for your own life, that it wasn't fair that you went through all these things too. And at the same time, you can choose to forge on. We all make choices, and you kind of, I didn't say this, but basically the concept of when life gives you lemons, make lemonade. I wouldn't stoop to that with most of my kids because that's very minimizing of the degree of the things that are happening with them. But it's the same basic idea, helping them feel like you can actually still move past this, and people do move past this, and being a positive model for that. And in that case, it was helpful. But for the most part, I leave a lot of it out of it. I even think a lot about, what even do you keep in your office or in the room that you're meeting with the kids? Because going back to the whole protective mechanisms and manipulation and dishonesty and stuff, these kids are fantastic as well as zeroing in on any sort of insecurity and just digging into that and poking their fingers in it and widening that space. And it's just another avoidance tactic, really. Again, people see it as like a personality or antisocial disorder kind of situation where they're just cruel, but ultimately it's a distraction. It's a way to derail the conversation. It's a way to move the topic away from them and how uncomfortable that is back to you, and make it about everyone else so that they don't have to deal with it. Also reinforce their own rationalizations and kind of prove that, like, well, you're messed up and you can't deal with this, so who are you to tell me anything about myself and what I should do about myself? And so that is kind of one of my critiques I might have given Robin Williams if he was one of my supervisees is, if your wife is a weak spot for you, or maybe a better phrase is just something that you don't like other people talking about, don't put things up in your office that point out that you're married. I've known people that they take off their ring before sessions. They don't keep any pictures in their office. And I'm kind of the same way. Like, if you have something that you wouldn't want someone saying negative things about, then don't even allow that conversation to happen. And we see that play out in a weak moment for Robin Williams, where he's got this painting from his wife, and Will notices, because he's just kind of fishing. Again, he's testing the waters, and he finally finds something that makes Robin Williams feel a little bit uncomfortable and shakes him a little bit. And he starts talking about the painting, and he's like, ooh, he's getting kind of mad that I'm talking about this painting. I wonder why. And he just rolls in and just starts, digging and poking. And Robin Williams loses it, and he even pins him against the wall in a chokehold and says that he will end him. And I've seen things like that happen. Usually not to that physical degree, but again, people getting very upset that this insecurity has been exploited. So I always tell people, if you don't want people talking about certain things, then make sure there's no sign of it on you that they can pick up on. And also, just to be real, just develop a thicker skin, because they're good at sniffing these things out anyways without any help, because it's just another way that they've learned how to survive and just mentally kind of deal with their own life by making themselves feel better about other people's problems so that they don't have to feel so bad about their own. But he rebounds from it pretty well, although that could have easily turned into a lawsuit, and Robin Williams would have very much been at fault. That stuff happens all the time. They push you to the edge, and ultimately, at the end of the day, he was the one who put hands on Will, and Will would have had every right to file a complaint and, get his license taken away, and probably even get him arrested, because that was assault. So definitely no props there. But obviously it makes for, a great scene in a Hollywood movie. But really, my probably biggest point of contention with this movie is, even though I love this scene and I still get choked up every time I watch it, it's that classic "it's not your fault" scene. Again, from a filmmaking standpoint and a character standpoint, and just how the dialogue is delivered and the acting is so great, that's a great scene. However, I have problems with it from a counseling point of view, just that it's much more powerful, again, to have somebody sit on an idea and process it themselves and come to their own conclusion on something. That's why the concept of Socratic questioning is so important in various realms of counseling. We use it a lot in processing trauma, is instead of telling someone it's not your fault, we want them to come to a conclusion on their own that it's not their fault. So for example, I've had kids in this similar space where they did blame themselves to some degree of what had happened to them. Using the concept of being physically or sexually abused would often come up, where they felt like because they derive some sort of sexual pleasure from it, which is a physical response that they can't control, but they still felt like, well, I kind of like physically enjoyed it, and so therefore like I share some of the blame here. Or I could have fought back is another common one. Like I could have fought back and protected myself or protected my sibling or whatever. And so I could do what Robin Williams did and just say, hey man, it's not your fault, because, you know, you can't control that, and yada, 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 like just give all these reasons. And it's still kind of like, yeah, okay, but I still feel like it was my fault. And they may even nod their head and act like they agree when they don't. So instead, you just ask a lot of questions to help them get to the conclusion you want them to. So a common one I would have is, again, the kid would say, well, you know, I should have fought back. If I'd fought back, then this never would have happened. And I'd say, okay, so remind me again, how old were you when this happened? They're like, well, I was 7. Okay, you were 7 years old. How much do you think you weighed when you were 7? And they'd spitball with me, you know, I don't know, maybe, 60 pounds. Okay, so let's say that's accurate. Let's say you weighed 60 pounds. How tall was this guy that attacked you? Oh, he was about 6 feet tall. Okay, how much do you think he weighed at the time? Oh, probably 220 pounds. Okay. All right, so interesting. So what you're telling me is that your 7-year-old, 60-pound self could have fought off this 6 foot tall, 220-pound, full-grown man. And I just let that linger. And most people will, once you bring it to that logical conclusion, and again, I haven't told them what to think. I'm not telling them the logic there. I've just asked them a series of questions and then asked them a very provocative final question, putting together what they've already told me. And usually what happens in that point is, in their brain, they go, oh, that doesn't make sense, does it, when it's presented that way? And they're like, well, no, I guess I couldn't have. I'm like, okay, yeah. I don't really think so either. Like, that doesn't really make sense now, does it? And sometimes we'll throw in, a bunch of other, we'll have a series of kind of, it's like mental sword fighting almost, just to get them to that place. I've also described it as like the movie Inception. It's more powerful to like plant an idea than to just tell someone that. So I'm planting these little seeds to kind of rain on their parade and sort of tell them that like that doesn't make sense. And ultimately, they're the one who is able to say, you know what, you're right. Like, and I'm like, no, I'm not right. Like, you're telling me. Like, what is it you're telling me right now? And then they'd say, it's not really my fault. Like, maybe, and a lot of times it's just kind of more grayed up. They're like, well, it's still a little bit my fault, but it was mostly their fault. I'm like, okay, I'll take that. That's improvement. And not every victory is a slam dunk. Sometimes it's just a little layup, but it's still helpful. And that's, a good start, especially for young people that can grow on that and continue throughout their lives to take on more of those positive messages and thinking about it. So that's really my one really counseling issue with this movie, is that scene, is that it would have been more powerful for him to get there. I think he kind of does, and that's part of it, and with the repetition and everything. But still, I mean, I can't really think of too many sessions that have played out that way. It's much more profound usually when it's been a series of sessions where we've been able to really ask those tough questions and them to come to this place. And just it's usually more subtle too. But again, makes for a great scene. Love watching it. Makes me cry. But good stuff. So, Good Will Hunting. Great movie in general, but also pretty solid portrayal of what it means to deal with trauma and also how to work with it and how to be, on the whole, a pretty darn good counselor that's going to be able to to develop a relationship and that trust while also pushing and challenging and ramping up the difficulty on some level. Just, don't get physical. That's the other thing I'll definitely throw in there. But that aside, it's a great example of kind of what this work can look like in a quick snapshot. So hope that was interesting and enjoyable to you. As always, please do like and subscribe, share with your friends if you have other people that you would like to hear this stuff. Always trying to grow our listening base. But as the wise sages Bill S. Preston Esquire and Ted Theodore Logan always say, be excellent to each other and party on, dudes.